We are pleased to welcome you to the Healthy Life Care channel, which primarily focuses on the health of those aged 60 and above. We want to alert you to potentially beneficial information we possess. These are the 6 most potent nutrients that may assist seniors in preventing leg weakness. As we age, it is customary to emphasize the safeguarding of our bones, brain, and heart. However, what concerns our legs? Despite their role in supporting us through decades of activity, these invisible structures are often overlooked until we are compelled to acknowledge them due to discomfort or frailty. Healthy legs are essential not just for the comfort of elderly individuals, but also for their independence, balance, and overall quality of life, and so need maintenance. The elderly are surprisingly vulnerable to leg-related ailments, which may profoundly impact their lives. Arteriosclerosis, sometimes referred to as sarcopenia, is a disorder that results in the weakening of the feet and legs, hence complicating each step. Chronic inflammation, joint stiffness, and deteriorating cartilage together diminish mobility and increase the risk of falls. Individuals with diabetes may have numbness, non-healing wounds, and potentially severe complications due to compromised circulation and nerve function. Conversely, there is positive news. Leg health may be preserved and rejuvenated with appropriate nutrition. A compilation of non-vitamin, non-mineral substances that directly improve leg strength, structure, and functionality exists. Although most talks on nutrition focus on vitamins and minerals like calcium, vitamin D, and magnesium, there exists an equally significant group of substances that are neither vitamins nor minerals. I would appreciate it if you could inform me of your origin today as we start. Please leave a comment below and feel free to pose any queries you may have. Additionally, remember to subscribe to our channel for further guidance on healthy aging, grounded on scientific research. Your extremities will express gratitude towards you. Let us start with a discussion on protein, shall we? As we age, a primary sign of aging often seen is a change in the look of our legs. Ascending and descending stairs becomes more challenging, prolonged walking becomes more fatiguing, and simply standing up from a chair may need greater exertion than before. Approximately 1/3 of individuals over 60 years of age exhibit sarcopenia, defined by a gradual decline in muscle mass and strength. These little fluctuations often serve as the first indicators of sarcopenia. Is this biological degeneration an inevitable process, or is it something we can halt? Is it feasible for a singular vitamin to aid in preserving the strength and vigor of our legs as we age? The nutrient in issue is protein, and the response to your inquiry is affirmative. Protein is advantageous not just for athletes and bodybuilders. The functioning of the legs is a crucial aspect of healthy aging for individuals in their later years. Protein serves as the fundamental component of our muscles, and with advancing age, our capacity to use it for muscle repair and regeneration diminishes. Due to this phenomenon known as anabolic resistance, the body must ingest a larger amount of high-quality protein to get the same muscle-building response that was previously attained with lesser quantities. Consequently, protein has garnered a reputation as a genuine powerhouse. It provides the fundamental components required for the preservation of lean muscle tissue, which is crucial for sustaining mobility, balance, and strength in the legs. Leucine, a particular amino acid, serves as a biological switch and is prevalent in foods like dairy products, eggs, and lean meats. This is an even more remarkable facet of the friendship between the two. Leucine activates a vital developmental pathway in the body known as mTOR, which signals the initiation of muscle building. In the absence of the signal, even a protein-rich diet may insufficiently maintain muscle maintenance in aging legs. What are the consequences of inadequate intake? The degradation may occur gradually, although the ramifications may be substantial. Weakened legs, heightened fall risk, less mobility, prolonged injury recovery, and an increased likelihood of losing independence. Despite maintaining a sufficient caloric intake, a protein shortage may lead to muscle degradation, which is not compensated by strength, but rather by fatigue. Fortunately, this is a problem we can actively resolve. To mitigate anabolic resistance, the latest study suggests that older individuals should increase their protein intake beyond the previously recommended range of 1.2 to 1.5 grams per kilogram of body weight per day, and should evenly distribute this protein intake throughout the day. Instead of postponing protein intake for your legs until supper, provide them with necessary nutrients at every meal, especially at breakfast and lunch, when many senior individuals often consume less. Moreover, the origins of protein are significant. Proteins abundant in leucine, like whey, eggs, fish, poultry, and Greek yogurt, are especially advantageous. Moreover, plant-based options, such as tofu, lentils, and quinoa, may substantially enhance nutritional value when combined appropriately. Protein powders and shakes provide a convenient and concentrated solution for those who struggle with mastication or have a reduced appetite. Omega-3 fatty acids in second place. The majority of individuals, when encountering the phrase fat, do not associate it with healing or strength. Instead, they see it as something to be avoided. Conversely, what if a certain kind of fat has the capacity to achieve the exact opposite effect? How would you feel if it could mitigate joint discomfort, improve blood circulation to your legs, and protect the delicate nerves essential for mobility? Omega-3 fatty acids are specifically recognized for their significant potency. Discomfort, rigidity, and edema in the legs are common grievances among the elderly, often linked to low-grade chronic inflammatory manifestations. Inflammation often serves as the hidden element that leads to a deterioration in leg comfort and movement. This issue may present itself in several forms, such as calf pain, knee arthritis, or ankle discomfort. Omega-3 fatty acids serve as a natural anti-inflammatory agent. They are not an immediate remedy, but rather provide long-term benefits. Omega-3 fatty acids operate internally, gradually attenuating the body's inflammatory response at the cellular level. This contrasts with over-the-counter medications that temporarily alleviate pain. The two predominant types of omega-3 fatty acids present in fish oil are eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA. These two forms of omega-3 fatty acids may influence the production of signaling molecules called eicosanoids and resolvins, which facilitate the resolution of inflammation rather than exacerbate it. What is the final outcome? The capacity to articulate joints with more freedom while encountering less edema and rigidity, with legs that seem less encumbered by the chronic discomfort they endure. Inflammation is only one of the several domains in which omega-3 fatty acids may provide advantages. As we age, there is a natural decline in circulation to the lower extremities. In individuals with diabetes or peripheral artery disease, the tiny capillaries that provide oxygen and nutrients to the legs and feet become less efficient, potentially resulting in many painful symptoms, such as cramping, cold feet, and delayed wound healing. These symptoms may become more severe. Omega-3 fatty acids enhance endothelial function, which pertains to the health of the inner lining of blood vessels. An increased supply of oxygen and nutrients is provided to your leg muscles, nerves, and skin due to their capacity to induce vasodilation, so ensuring smooth blood flow and preventing clot formation. Enhanced circulation not only enhances well-being, but also establishes the foundation for stronger legs, expedited recovery, and less risk of complications. Robust evidence indicates that omega-3 fatty acids may have a protective role in neuronal health. This is particularly applicable to those feeling tingling, burning, or numbness in the legs, which are hallmark symptoms of peripheral neuropathy. Omega-3 fatty acids mitigate oxidative stress and facilitate neuronal repair. Omega-3 fatty acids may assist in preserving sensation and mitigating discomfort in the lower extremities. This is especially significant for elderly individuals with diabetes or vascular issues, since diminished sensation may result in unnoticed injuries or infections. You may be curious about the source of this remarkable fact. Salmon, mackerel, sardines, and anchovies exemplify cold-water fatty fish rich in EPA and DHA. These species are the premier sources of omega-3 fatty acids. For those who do not regularly eat fish, acceptable options include pure fish oil supplements or algal oil, which is a vegan option. Numerous studies endorse the use of 1,000 to 2,000 milligrams of mixed EPA and DHA daily to attain anti-inflammatory and cardiovascular benefits. The recommended quantity fluctuates depending on the individual's needs. Lastly, collagen. Though it may be imperceptible, a concealed foundation underlies every strong stride, flexible knee, and sturdy ankle. This structure is collagen. It is accountable for supplying elasticity to your ligaments, cushioning your joints, and interlacing with your tendons. In other terms, it physically constrains your legs in proximity. Conversely, over time, this structural matrix progressively diminishes in strength. The joints commence to ache, your knees get more challenging to flex, and your legs forfeit the impression of stability and resilience they formerly had. Currently, the question is whether it is feasible to compensate for the time that has been squandered. Can collagen really restore the integrity of our aging legs? The answer is promising, beginning with collagen peptides as the cornerstone. The architecture of connective tissue mostly consists of collagen, the most prevalent protein in the human body. However, upon reaching the age of 30, your body will begin to produce less collagen each year. By the time you reach your 60s or 70s, you will perceive a reduction in the condition of your knees and the tendon that has been elongated beyond its typical length. While the manifestation of collagen loss may be delayed, it is as consequential as the reduction of muscle mass, which may sometimes be visibly remedied with exercise and protein intake. At this juncture, collagen peptides are relevant. Hydrolyzed collagen peptides vary from conventional dietary collagen as they are decomposed into short chains of amino acids that are easily absorbed into the bloodstream. Upon arriving at their destination, they do not just disappear. Instead, they migrate to the connective tissues and joints, where they serve as messengers that stimulate collagen production in the body. Individuals who regularly consumed collagen peptides engaged in clinical research and reported less joint discomfort, enhanced flexibility, and a rise in bone mineral density throughout the trial. This leads to enhanced knee stability, strengthened ankles, and a possible decrease in the risk of soft tissue injuries in older individuals, which may need many months for recovery. However, the role of collagen extends beyond strength. It also encompasses mobility. The enhanced mobility of your legs is directly attributable to the adequate upkeep of collagen-rich tissues. The plantar fascia, a robust band from the heel to the toes, provides support for each stride without inducing strain. The knee articulates smoothly, the Achilles tendon flexes without discomfort, and the plantar fascia bends without inducing inflammation. Each of these minute but crucial elements of leg function relies on the existence of optimal collagen architecture. Nonetheless, collagen alone is inadequate. For actual success, it relies on numerous essential cofactors, including vitamin C, which acts as a catalyst for collagen formation. Regardless of collagen intake, the body cannot effectively synthesize or replenish collagen in its absence. Consequently, several high-quality collagen supplements either include vitamin C as an adjunct or recommend its use with citrus fruits or bell peppers. Moreover, timing and consistency are crucial. Most therapeutic benefits manifest after daily administration for a duration of 8 to 12 weeks. Collagen peptides are often derived from bovine, marine, or porcine sources. This is the most predominant source among all sources. While all collagens include essential amino acids necessary for the healing of connective tissue, including glycine, proline, and hydroxyproline, marine collagen is often praised for its superior absorption. Bovine collagen remains the most extensively researched collagen for joint and bone support. Creatine ranks fourth. Is there a means to replace the deep cellular energy that sustains robust and powerful legs, particularly in aging bodies? Creatine is sometimes misconstrued as a bodybuilding supplement. Nevertheless, it is becoming acknowledged as a vital component for promoting healthy aging. Creatine is a naturally occurring compound stored in muscle tissue, functioning as an instant energy source. Whenever you stand, ascend, or lift, your muscles use creatine to regenerate ATP, the compound responsible for muscle activity. This is especially accurate when the activity is vigorous or intense. It is like having a backup generator for your legs. Conversely, as we age, our natural reserves of creatine diminish, thereby reducing our ability to generate energy swiftly and efficiently during physical activity. What is the final outcome? Rapid fatigue in the legs, a diminished walking speed, and a progressive but possibly lethal decline in balance and confidence, are all manifestations of this illness. Notably, creatine is among the most extensively researched supplements, demonstrating efficacy in counteracting age-related muscle mass decline. It has been shown to enhance lower body strength, muscle mass, and functional performance in older adults when combined with minimal resistance training. Meta-analyses demonstrated that older adults who supplemented with creatine while engaging in regular exercise saw significant enhancements in walking speed, chair rise time, and leg strength compared to those who did not supplement with creatine. Creatine seems to aid with muscle retention, giving the legs a foundation of strength even in the absence of rigorous activity. This applies even to those who are sedentary or frail and do not engage in physical activity. The benefits of creatine, however, transcend mere muscular enhancement. Recent research indicates that it may also help preserve bone density. This is likely due to the increased stress that muscles exert on bones as they get stronger. This is a significant factor, particularly for the legs, which bear the body's weight and are more prone to fractures from falls. To enhance bone strength, it is essential to have stronger muscles, and creatine facilitates the enhancement of both. In contrast to the advantages of other nutrients, which may take many months to manifest, the effects of creatine are often evident within a few weeks. Alongside a general sense of restored leg capability, users have indicated heightened energy levels during ambulation, enhanced stability while standing from a seated position, and overall better stability. What is your opinion on the matter? The most common kind is creatine monohydrate, a well-researched and cost-effective option. It is widely regarded as safe and advantageous for elderly individuals to consume a daily intake of 3 to 5 grams. A uniform methodology is all that is necessary. Loading phases and cycles are unnecessary. For maximum absorption, it is advisable to ingest it post-meal. It may be mixed with water or used in a smoothie. What are the negative consequences? Numerous research studies on creatine indicate that when ingested in prescribed quantities, it is considered rather safe, particularly for the elderly. Initially, there may be some water retention. However, this issue often resolves quickly. In clinical trials, concerns about kidney health in healthy individuals have been significantly refuted, which is a crucial and noteworthy finding. Lastly, glucosamine. Glucosamine is somewhat unremarkable. Although it is neither a trendy superfood nor a high-performance supplement, it has consistently been one of the most researched nutrients for joint health throughout the decades. This is particularly applicable in the context of osteoarthritis, characterized by the progressive degeneration of cartilage, impacting millions of aging individuals. Glucosamine serves not only as an analgesic, but also as a fundamental constituent and structural element of the molecules that form cartilage, synovial fluid, and connective tissue. This characteristic makes glucosamine a distinctive compound. It might be regarded as the fundamental substance for joint repair. The body's ability to sustain and regenerate cartilage diminishes with age. The ultimate result is a decrease in the thickness of the joint surfaces, accompanied by inflammation, stiffness, and pain, especially in the weight-bearing joints of the legs, with the knees experiencing the most significant suffering. Glucosamine is essential for maintaining the thick, viscous fluid that lubricates and nourishes joints inside, and it is a crucial element in the body's natural cartilage-building process. Numerous long-term studies, including those included in Cochrane meta-analyses, have shown that glucosamine, especially in sulfate form, may reduce joint pain and impede cartilage degeneration, particularly in the knee. While much of this study focuses on the knee joint, the concepts presented are also relevant to the smaller joints of the ankles and foot. Cartilage deterioration may be as detrimental in these joints. The stabilizing effect of glucosamine may be the least recognized aspect of this compound. Conversely, glucosamine provides structural support, unlike brief therapies that just mask pain. Over time, it gradually fortifies the interior structure of joints, a process that occurs slowly. Users often report little but impactful benefits, including less cracking, enhanced flexibility, improved fluidity of movement, and heightened confidence in doing daily activities such as ascending stairs or traversing uneven surfaces. Glucosamine is an effective complement to chondroitin, another substance that supports cartilage health. The amalgamation of these two substances has shown a significant and sustained improvement in mobility and joint comfort. Nonetheless, glucosamine alone remains advantageous, especially when administered at an initial phase, prior to the advancement of joint degeneration. As it is a gradual treatment, it does not serve as an instantaneous cure. Conversely, regarding aging legs, a gradual and consistent approach prevails. What is the appropriate method for administering it? The recommended daily dosage of glucosamine sulfate is 1,500 milligrams, often partitioned into 2 or 3 smaller doses and administered with meals. Given that it may take 4 to 8 weeks for discernible benefits to manifest, consistency is crucial. Although widely recognized, those with shellfish allergies should proceed with care, since several supplements are derived from shellfish exoskeletons. Furthermore, there is currently an abundance of options that are either plant-derived or synthetic. That refers to curcumin. Curcumin's notable anti-inflammatory and antioxidant properties have garnered global interest in recent years. Curcumin has a long-standing history of use in traditional medicinal systems, including Ayurveda and Chinese herbalism. Nonetheless, this issue transcends folklore. Current science has substantiated the advantages of curcumin via several studies, particularly focusing on its role in chronic joint and muscle ailments. Curcumin has shown efficacy in treating osteoarthritis, tendinitis, and inflammatory pain, conditions often impacting the legs and lower limbs of those aged 60 and above. Consequently, what is its mechanism of operation? Curcumin disrupts the inflammatory cascade at the cellular level by blocking key enzymes, including COX2 and lipoxygenase, as well as signaling molecules such as TNF-alpha and interleukins, which are responsible for the generation of edema and pain. Curcumin is gentler on the body compared to conventional non-steroidal anti-inflammatory medicines, NSAIDs, which may include gastrointestinal side effects or long-term risks. This is especially accurate when curcumin is consumed in appropriate formulations. Curcumin has shown equivalent efficacy to ibuprofen in alleviating joint pain and stiffness in individuals with arthritis while exhibiting a much-enhanced safety profile. Clinical trials have shown this. For aging legs, this indicates less swelling in the knees, decreased strain on overused tendons, and enhanced comfort during movement. It is particularly beneficial in treating conditions like plantar fasciitis, which is characterized by inflammation of the thick tissue band along the foot sole, causing heel pain with each step. This condition is notoriously difficult to manage well. Due to its ability to alleviate pain and expedite tissue repair, curcumin is among the few naturally occurring compounds that not only mitigate symptoms, but also hold promise in addressing the underlying causes. The antioxidant properties of curcumin provide protective benefits that extend beyond the joints and tendons. Muscles and neurons that age are persistently subjected to stress from free radicals, which are unstable molecules that cause tissue damage over time. Curcumin neutralizes these radicals, preserving muscle integrity and promoting neuron function. This is a crucial element in the prevention of leg numbness or neuropathic pain, especially in those with diabetes or circulatory problems due to their illness. Bioavailability has undeniably been a long-standing challenge for curcumin. It does not assimilate properly into the circulation when consumed in its raw state. Fortunately, this issue has been addressed by modern formulations. Curcumin combined with piperine, black pepper extract, phytosomal curcumin, and nanocurcumin are improved variants that are already available and much more efficacious than their conventional forms. Consequently, the whole therapeutic potential of curcumin is now accessible. The recommended dosage of curcumin extract for joint and inflammatory support typically ranges from 500 to 1,000 milligrams daily. However, individual needs may vary. Most persons begin to see results after 4 to 6 weeks of consistent use. It is not an instantaneous solution, but a slow progression towards comfort and liberation. Concluding reflections. During this journey, we examined 6 powerful nutrients, each with a specific role in enhancing leg health, substantiated by scientific research. Protein is fundamental for preserving and reconstructing muscle mass. Therefore, it aids in the recovery of strength that the natural aging process seeks to progressively erode. The presence of omega-3 fatty acids facilitates unobstructed blood flow and reduces leg pain by mitigating chronic inflammation, which tightens joints and impedes circulation. Collagen peptides enhance mobility and joint comfort by fortifying the tendons, ligaments, and cartilage that provide structure and stability to the legs. Creatine rejuvenates the muscular energy system, enhancing strength and endurance with each step. This effect is especially vital for preventing falls and maintaining independence. Glucosamine repairs and protects the cartilage in our joints, providing cushioning during movement and aiding in the preservation of flexibility over time. Curcumin provides natural relief from long-standing inflammation and pain, while also offering a gentle but effective means to preserve mobility in the legs, even within chronic conditions. Their synergy, characterized by the amalgamation of their complementary effects, yields enduring results. Simultaneously, one aids in preserving muscle, while another nourishes joint tissue, one mitigates inflammation, and another promotes healing. Undoubtedly, each individual is distinct. Consulting a healthcare professional prior to initiating any new supplement is crucial, especially if you have previous conditions or are currently on prescription medications. Customized instruction ensures that these nutrients will operate for you in a method that is both secure and efficient. Surgery, injections, or waiting for deterioration are unnecessary prerequisites for starting the journey toward healthy legs. The process starts with nutrition, including a sequence of intentional choices made incrementally. You now possess the knowledge, the facts, and most importantly, the capacity to act. Supply your legs with the necessary sustenance, enabling them to propel you forward, more robust than ever before. If you found this movie advantageous, please remember to press the like button. It allows us to provide you with more valuable content. We would be grateful if you could leave a comment below, sharing your ideas, inquiries, or recommendations for the future topic of discussion. We appreciate maintaining communication with you. To be informed of our latest health recommendations and insights, please select the subscribe option and activate notifications. We look forward to your presence in the future video. Thus ensure you stay informed and prioritize your health.